Hello, DPS community. Welcome to the EDUCA DPS Podcast, where we inform families and connect communities. My name is Javier Ibarra, your host of the EDUCA Podcast in English. Today in the DPS studio, we have Julissa Soto, CEO of the Latino Health Equity Consulting, an organization that is dedicated to serving lower income families, refugees, and all students in the community who might otherwise face barriers to receive care. Julissa is generously here to enlighten us on one school, one vaccine at a time program. Julissa, welcome to the EDUCA DPS Podcast. How are you today?
Good. Thank you for inviting me. I'm super excited to be here.
I'm glad that you're here because I know we've been trying to get you on the show and our schedules haven't aligned, but we're here today and we're going to talk about a great topic for all of our audiences. So before we get started, I want to give our audience a bit of background information, right, on the topic. So one school, one vaccine at a time, or in Spanish, una escuela, una vacuna a la vez. Through this program, Latino Health Equity Consultant partners with school districts and health providers to bring wellness, education, community-based resources, and routine childhood immunizations directly to children, students, and their families. By using a cultural validation approach, which is key here, they meet communities where they are and break down barriers to vaccine hesitancy and access to care. Their teams are multilingual and work to research and the various cultures within the school districts before they come on campus. Latino Health Equity Consultant is dedicated to serving families with lower incomes, refugees, and all of other districts who might otherwise experience barriers to care. So, Julissa, I want to start off with, can you tell us about this campaign, one school, one vaccine at a time? Tell me more about that.
Yeah, one school, one vaccine at a time was born when we were trying to get to communities of color, communities that were monolingual Spanish speakers. We were trying to get to their homes or, their healthcare, right? The healthcare system, but it was almost impossible because a lot of the families know Shots for Tots, which is a program for vaccines too. But a lot of these families were like, Shots for Tots, we just don't understand. Are those vaccines only for little children or for everyone? So myself and the health department say, we need to change the name to one school, one vaccine at a time, una escuela, una vacuna a la vez. It was something that all families could understand. So that's how the campaign started. And also I wanted the health department and myself to go to the schools and meet children and parents where they were at. That didn't exist before. Before, we used to meet at the fireplace, which it was not very welcoming for everyone, and not all families were showing up because they were scared. Also, we were at the fire department. Some of these families might have uncertain status, and they were like, I don't know if we should go there to get our vaccines.
Sure.
So we changed the process to one school, one vaccine at a time, and then meeting people where they're at, which it was at their schools.
Julissa, I'm glad that you talked about that because here, part of this multimedia team that produces this podcast and other shows, we're part of the communications department. And in communications, I think it's important to understand that sometimes we use titles for programs that only resonate with English speakers, and they don't resonate with any other language speaker, right? And so I think that it's important to make sure that whatever title that you have for these programs, it translates culturally as well to other languages. And so my next question for you is, can you tell us, when did you start this campaign, right? Give me for the folks listening here, tell me about what it looked like. What did the early days look like?
Perfect. So we believe in transcreation, not translation. Like you say, we needed to find a name that was transcreated and not translated, because a lot of the times we utilize titles that work for a certain community, but then when you transcreate or you translate, it doesn't work the same way. So I said to our team, we need to start transcreating and not translating. And that's why we say, okay, for the Anglo community, let's leave shots for tots, but for the Latino community, one school, one vaccine at a time. And for other communities, because it transcreates well in all levels. This campaign started during the COVID pandemic. A lot of the schools were closed, but then when the schools started opening, I said to my team, now we need to get to the schools and start educating the families on what vaccines are all about, why is it important, and we need to go where they're at. You know, we in the past have asked families to come to the health departments, which is very difficult for some of the families because social disparities of health exist. If you don't have transportation, if you don't, and even if you have transportation, if you have $100 for gas, for example, are you going to go to a clinic where your copayment is $20 but you have 5 kids? There's your $100 for gas or for food or for vaccines, right? So I said, no, I want to bring a program to the schools where we can bring those vaccines at no cost to the families, and also the families are already there picking up their children. So we have after hour clinics, that's how we call it. After hour clinics, we are open 3 to 7 p.m. We go to the school, they invite us, and then we're open 3 to 7 p.m., 4 to 8 p.m. It depends on what the school wants from us. We bring our health department with us, and we start offering vaccines at no cost to the families when they're picking up their kids. We're also waiting for them when they get off work. They can still stop by with their children to vaccinate the whole family. Because if one student is not compliant, more likely mom, dad, brother, sister are non-compliant. So more likely we like to vaccinate the whole family. So this is not only a student approach campaign, it's a family approach campaign because we validate the cultures of the communities that we wish to serve for better health outcomes.
I think it's important to note for our audience members here that you go to them.
Yes.
Right? And so why? Why have that, right? People are going to ask, why do that? Because it's a cultural thing, right? You just explained to us that we have an opportunity to reach folks, but if they had $100 for food and they have to use it on gas or copay or whatever. And so I just wanted to highlight that for our audience. My next question for you is, how long have you been doing this? How long has one school, one vaccine at a time been happening?
Okay, one school, one vaccine at a time started. I was born 4 years ago, but me, myself, I have been in the healthcare system working to serve the Latino community for 27 years. 27 years. 27 years, almost 3 decades. Almost my age since I was born.
Wow.
I'm almost 30 years old, so I've been doing my work since I was 30. Yeah, almost the same time.
Yes.
3 decades. That's my age. Let's leave it at that.
That's the secret to the fountain of youth is the vaccines.
The vaccines. It's the vaccines. Get all your vaccines. Get over your vaccines. Parents, mamas, you're listening to this. Get your vaccines.
So, Julissa, tell me, are you seeing any hesitancy, right? Apart from the transportation barrier, right, which is one barrier, what are some of the other barriers that you're seeing from families about getting vaccinated?
You know, I never saw hesitancy per se. In the past, I used to hear from the health departments, from other professionals, Latinos are vaccine hesitant.
Yes.
And I was like, no. Let me organize one health clinic. And that's what I said to the health department. I'm going to organize one health clinic, one vaccine clinic, and from there you guys are going to take it. You're going to see that we're approaching families with respect and dignity, and they're going to come to our vaccine clinics. They're not hesitant. So the first time that I organized a vaccine clinic, I vaccinated 1,279 Latinos.
The first time?
The first time, in one day.
Wow.
In one day. I went to the health department and I said, does this look like hesitancy to you? It was never hesitancy. It was the access. We were not providing vaccines and access after our clinics. That didn't exist.
Right.
You know, in the past, that didn't exist after our clinics. What else didn't exist? Also going to the communities, meeting people where they're at. That was not existence. The health departments wanted us to go to the health department buildings, which is government buildings. A lot of our families have uncertain status. Do you think they want to go to government buildings. Plus, government buildings are stuffy, are not fun.
Right.
Julissa Soto and her team offer vaccine parties. We call it vaccine parties because we bring to the schools the balloon guy, jumping castles. One time I brought in one of the schools a circus, believe it or not. I brought the circus,
a full circus,
for children to get vaccinated because I want the children not to be traumatized.
Right.
I want the children to remember their vaccines as something fun. Positive, I don't know if you remember way back then when they used to vaccinate us, they just to put us in line and you hear the children crying and you were like, oh, it's my turn.
Next.
I'm next. This is going to happen to me.
Yes.
Now the kids hear other kids crying, but they don't pay that much attention because they're out there. Fun. They're having fun.
Yeah.
I also bring piñatas, and inside the piñatas, I put candy and also home COVID-19 test boxes.
Wow.
So when they break the piñatas, they can take the home COVID-19 test box to their mom, and then they can keep the candy. So I'm raising awareness on prevention and all of that. So it's a lot of fun.
You know who you remind me of? You're kind of a pioneer. I don't know if you've heard of, I'm going to butcher his name. His name is Richard Montañez. He is the director of marketing for multicultural outreach at Frito-Lay. And so they made a movie about him. So he's the creator of the Hot Cheeto.
Yes.
And you remind me of him because he had a problem. It's not that in the movie, it's not that the people didn't want a spicy chip, is that they didn't have access to a spicy chip. And then once they had access to the spicy chip, they didn't understand it, right? And so he pioneered marketing efforts in order to get people to buy in and then eventually buy the spicy chip. And that's exactly what you're doing with the vaccines, right? You're thinking, okay, we have a transportation barrier.
Yes.
How do we mitigate that, right? And then we have traditionally a negative connotation with vaccines. How do we mitigate that? And so that's exactly what you're doing, right? I'm excited to see what the future of your program looks like. And then hopefully you invite us so that we can go out there and have some fun too. And then get our vaccinations, because this sounds not only beneficial health-wise, but just a good time overall.
It's a good time overall, and the children are kind of confused when they come to my clinics. They're like, oh, is it your party? Mrs. is, and I say, yeah, and I invited you. You're invited. That's why you're here. They're like looking at their parents, and one of the kids one day say, Mom, we didn't bring a gift. And I said, no, the gift is you, mijo.
Yes.
The gift is you. And they were like, oh, thank you. I said, go break the piñata. In the meantime, they're waiting for their turn to get their vaccines. And when they're getting their vaccines, I'm like, hurry up, mi niño. Don't think about the vaccine so you can come back and play. One of the kids also was like, my arm hurts. But when it was his turn to break the piñata, he forgot about the pain. No, his arm didn't hurt. So I believe in my best practices. I believe that my best practices are being recognized nationally and internationally. I was overseas. I was in Germany. I was in Italy, Switzerland, and Paris, also offering vaccines at no cost to our community. So I know that my best practices are working, and I know that it's some resistance right now with politicians and health departments because it takes a whole lot to put a vaccine party together. But they have to think how many lives we're saving and how many children we're stopping to running to the emergency room, which at the end is most costly.
Yeah, and because it's access to healthcare, right?
Exactly.
So I remember this, and not to bring up old things from the pandemic, but they said, you have a certain survival rate for the COVID virus at the time, right? But that survival rate depended on availability of resource to a hospital and availability to respirators. And so if that hospital was full, all of a sudden your survival rate went down.
Yeah, exactly.
And so this is a great way. And so I just want for our audience to understand that this is a resource for you. This is a fun way for you to get your children excited and to understand more about the healthcare system, but also about the vaccines that save lives, right? And so, Julissa, I want to ask a few more questions before we go, because our time here is limited with you, because I know you got to be somewhere and very busy person, right? Are there any costs associated to these vaccines? We've talked a lot about the coolness and all that you can get. What is the cost?
No, these vaccines are free at no cost to the parents and no cost to the children. We also bring vaccines for adults. Those vaccines, if you're in the process of getting your citizenship, I know immigration asks for many of those vaccines. Those vaccines are very, very expensive somewhere else. With us, are free at no cost. Polio, MMR, all of those vaccines are at no cost for the parents and the children.
Right, and they're part of the required vaccinations to go to school, and so this is a great way to meet that requirement.
Yeah, it's the law in Colorado.
Right.
You can't be at school if your child is not up to date with vaccines.
Yes, of course. And so, last question for you, Julissa. Is there anything that you'd like to mention? Something that you said, oh, Javier didn't get to ask me this, but I really want to mention it. Is there anything that you want to mention before we let you go?
I just want to say to all of you parents, please come and visit us. Pretty soon we'll be at your school. I'm visiting every single school in DPS. So pretty soon, I will be in your neighborhood with this vaccine party. Bring your child, have fun, and break some piñatas. And I'll be more than happy to welcome you and with open arms and say thank you that you're saving your child's life. Remember, vaccines save lives.
Thank you so much, Julissa, for joining us here in this value information. This concludes our podcast for today. So thank you all for listening. And I want to thank again our guest, Julissa Soto, for this very useful information. We would like to ask all of our audience members to please share this episode of our EDUCA DPS podcast with your relatives, with your friends, with the DPS community. That's actually the best way to support this show, is to share this content. For this and more DPS multimedia productions and content, please subscribe to our YouTube channel at Denver Public Schools Plus. We are also on all of the main podcast platforms. Just search for the Denver Public Schools Podcast. A big thank you to our communications department and to our proud superintendent of Denver Public Schools, Dr. Alex Marrero, for the support to EDUCA and all of our multimedia productions. Please remember to tell your children more often. Julissa, what is this saying?
I believe in you and I know you can do it.
I'm Javier Ibarra. Until next time.